Welcome back into 643 here on your Monday morning. We're on the cusp of at least starting to reopen some businesses in Ohio, and for a lot of us that creates some pretty significant anxiety about what our safety will look like. So joining us this morning to answer some of those questions is Dr. James Kravec, the Chief Clinical Officer with Mercy Health. Thanks for hopping on board with us this morning. We appreciate it.
Good morning. How are you?
Not bad. I think some people think that they hear like the May 1st idea and think that, they'll be able to go to a restaurant or go to a movie theater again. But realistically, how gradual will this process have to be in terms of reopening businesses?
I think the most important piece is really a very gradual effort on behalf of the state, right? And I think that's where it's going. I think that's what we're going to hear from Governor DeWine and Dr. Acton later today or tomorrow, is the fact that this is going to be gradual. It'll be in a couple of phases. It'll be limited number of people for a while. So I do think that's very important, because if we go back to life as we knew it, in February, for example, we will see a spike of cases. So this has to be a very gradual ramp up over a period of probably months. We don't know yet, but probably months to get back to a life we used to know.
So when these businesses do start to reopen, then what are some of the things that all of us should be keeping in mind? Obviously, the social distancing rules are first and foremost in a lot of our minds when it comes to that. But what else should we be keeping in mind when we start to go back to some of these places?
I think that as we go back, I think the most important thing is we're going to be able to go back into them, but we still need to have the masks, potentially the gloves, if the social distancing, covering your cough. Staying home when you're sick, most importantly. I think those are the most important things that we need to realize. And also realizing that the businesses probably aren't going to be, completely as they were. There's going to be different rules, such as the lines and the marks on the floor in the grocery store, et cetera. So I think those are kind of some of the things we're going to notice.
How important, you mentioned the masks and potentially the gloves as well. How important is that step for us to be taking? I was out of the grocery store yesterday. I probably around like 80%-ish of people seemed like they were wearing masks or some sort of protective equipment. How important really is that going to be moving forward?
I think it is important. And really what that does is it's not really, in the beginning, people thought that protected them from catching the virus. But in reality, that's stopping each individual person from spreading it to others. And that's really important. I think it's something we should do. It is a recommendation of the CDC, so I recommend that as well.
So how big of a threat is a potential second wave? I know everything is going to be gradual in terms of reopening. How realistic of a threat is it? Is it possible to go back to what we just experienced? Maybe not here in Ohio, but I think of some of the other states that maybe are reopening in some people's eyes too quickly.
Yeah, I think if we do go back normal, I do believe there will be a second wave, a second surge. We did see a peak a week or two ago here. It was not as high as we hoped because of the social distancing, because of all the efforts that the state's taking. If we go back to normal, I am fearful that we'll see a higher surge. So we have to go back to normal in a slower fashion to allow that surge or that peak, whatever that is, to be much lower, to allow us to get back to normal at some point down the road.
So in your opinion, when do you think families should consider expanding their circle to maybe include some other relatives that aren't living in their home? What do you think the timeline might look like for that?
I still think it's going to be very slow. I think we're going to see the groups the Governor DeWine has with the max of, if it's your family now to 10 and to the 50 again, or whatever the number is. I don't know what that will be, but I still think we have to be very careful, because especially those over the age of 65 or those with vulnerable conditions, medical conditions, immune deficiencies, et cetera. There is a risk still. So I think it's just going to be some time still. I don't know. I can't give you a date yet, but we're going to see a very clear plan, I believe, from the governor over the next couple of days.
What do you think? The longer this stretches out, a lot of us are starting to think about our summer plans. Selfishly, that's just the way it is. We have vacations lined up and everything. In terms of going to a beach, going swimming, do you think that potentially this is something that could affect those plans? I'm not talking about crazy travel or anything, even locally.
Yeah, we're thinking the same thing. Mid-July, right? Are we able to go to a beach or go to a vacation spot, right? I don't know. I think there's concern. There's concern now. I think there's a lot of uncertainty with where that'll go. I think it depends on and I hate to say this, but it truly depends on how we do with the reopening. And if it spikes up again, then we could be in the same situation we were a couple weeks ago, in a couple months. So I don't know yet. I think it's too soon to tell. I wish I could tell, because my family is asking as well, and I think we have to make a hard decision, for some point over the next, 6 to 8 weeks or so.
Absolutely. So we'll see how this all goes with the governor unveiling his plan for the gradual reopening and everything. Dr. Kravec, thank you as always for taking some time out and lending us your expertise for a bit.
Great. Thank you very much. Have a great day.
Right back at you. All right. Thank you very much. And unfortunately, we're waiting for some answers, and we might not get them for quite some time as we continue to see how this all shakes out. All right. Keep it here. We'll be right back after the break.